Hi, my name is Fernando Triviño, and my topic about is the brief report barrier prolactin receptor in agalactia and hyperprolactinemia. First, first definition. In definition, the prolactin is hormone produced in the pituitary gland, named because of the role in lactation. It also has other wide-ranging functions in the body, from acting on the reproductive system to influencing behavior and regulating in the immune systems. Now, a video.
Prolactin, also known as luteotropic hormone or luteotropin, is a protein that is best known for its role in enabling mammals, usually females, to produce milk. It is influential in over 300 separate processes in various vertebrates, including humans. Prolactin is secreted from the pituitary gland in response to eating, mating, estrogen treatment, ovulation and nursing. Prolactin is secreted in pulses in between these events. Prolactin plays an essential role in metabolism, regulation of the immune system and pancreatic development. Discovered in non-human animals around 1930 by Oscar Riddle and confirmed in humans in 1970 by Henry Friesen. Prolactin is a peptide hormone, encoded by the PRL gene. In mammals, prolactin is associated with milk production. In fish it is thought to be related to the control of water and salt balance. Prolactin also acts in a cytokine-like manner and is an important regulator of the immune system. It has important cell cycle-related functions as a growth, differentiating and anti-apoptotic factor. As a growth factor, binding to cytokine-like receptors, it influences hematopoiesis, angiogenesis and is involved in the regulation of blood clotting through several pathways. The hormone acts in endocrine, autocrine and paracrine manner through the prolactin receptor and a large number of cytokine receptors. Pituitary prolactin secretion is regulated by endocrine neurons in the hypothalamus. The most important of these are the neurosecretory tuberoinfundibulum neurons of the arcuate nucleus that secrete dopamine to act on the D2 receptors of lactotrophs, causing inhibition of prolactin secretion. Thyrotropin-releasing factor has a stimulatory effect on prolactin release, however prolactin is the only adenohypophyseal hormone whose principal control is inhibitory. Several variants and forms are known per species. Many fish have variants prolactin A and prolactin B. Most vertebrates including humans also have the closely related somatolactin. In humans, 3 smaller and several larger variants exist.
Okay, now, an application in medicine. Application in medicine. One common cause of hyperprolactinemia is a growth or tumor on the pituitary gland called as prolactinoma. The tumor produces high level of prolactin. This tumor can be large or small and are usually benign, meaning they are not cancerous. Large tumors can also cause headaches, vision problems, or both. Now a video.
In the breast to produce milk. Prolactinomas are functional tumours, meaning that they secrete high levels of prolactin, and they typically form when there's a mutation in the lactotroph cells of the anterior pituitary that allows the cells to divide uncontrollably. The key is in the size with these things. Prolactinomas that are less than 10 millimeters in diameter are considered microprolactinomas, whereas those that are greater than 10 millimeters are called macroprolactinomas. Now, macroprolactinomas can compress surrounding structures, like the meninges, which is the protective layer overlaying the brain that typically causes pain when it's stretched. Also, an enlarged pituitary gland can compress the optic nerves as they cross at the optic chiasm. This can cause vision problems, as it affects a person's ability to view things that are in the temporal, or outermost portion, of the visual fields in both eyes. And this is called bitemporal hemianopia. Another name for this is tunnel vision, because the centre of your vision is clear, but everything in the periphery is dark, kind of like looking through a tunnel, I suppose. As well as all the local effects, the prolactin that gets secreted by the pituitary inhibits the hypothalamus from releasing gonadotropin-releasing hormone, which leads to a decrease in follicle-stimulating hormone and luteinizing hormone from the pituitary. Now, this is an issue because it results in less estrogen being produced in the ovaries and less testosterone in the testes. Low levels of these sex hormones can cause inhibition of ovulation in women and inhibition of spermatogenesis in men. In women, estrogen is also really important because it prevents the activation and differentiation of certain bone cells called osteoclasts. Osteoclasts normally break down bones and release the calcium into the blood. So, with decreased estrogen levels, osteoclasts are free to proliferate, and therefore, women with prolactinomas are at increased risk of fractures and osteoporosis.
Okay, now, and pros and cons. In pros, a prolactin level can return to normal. A pituitary gland normal function can be restored. Tumor size can be reduced. A treatment can improve quality of life. And cons, vaginal dryness, problem with menstruation, production of breast milk with no pregnant or nursing, erectile dysfunction, gynecomastia, decreased muscle mass and body hair. Now a video.
So, when it comes to symptoms, people with small prolactinomas or microprolactinomas often have no symptoms at all, whereas those with large prolactinomas, macroprolactinomas, might have vision problems like bitemporal hemianopia or headaches where the meninges is stretched. In women, excess prolactin causes galactorrhea, which is milky nipple discharge, amenorrhea, which is missed menses, and vaginal dryness and brittle bones in old age. In men, excess prolactin causes gynecomastia, or breast enlargement, and erectile dysfunction. And both sexes can experience decreased libido and infertility. The diagnosis of prolactinoma is typically based on elevated levels of prolactin in the blood. Sometimes there's also excess thyrotropin-releasing hormone, which may be stimulating the pituitary gland to secrete prolactin. Often, an MRI can be done to visualize the prolactinoma and classify it based on size. To treat prolactinomas, you can use medication or chop it out surgically. Since dopamine inhibits prolactin release, a clever way to treat it medically is with dopamine agonists like bromocriptine and cabergoline, which can be used to inhibit prolactin release. Now, surgery is usually only considered for individuals with macroprolactinomas, or those who fail medical therapy. If complete resection of the prolactinoma is not possible, or if prolactin levels remain elevated after surgery, radiation therapy can sometimes be useful. Okay, we made it, that's it. So let's just quickly whiz over the main points. Prolactinomas are benign tumours of the anterior pituitary that result in the excess secretion of prolactin. Excess prolactin can cause a wide range of symptoms, including galactorrhea, which is a milky discharge from the nipples, gynecomastia, which is breast tissue growth in men, amenorrhea, or missed menstrual periods, and infertility. It's typically treated either with dopamine agonists or with surgery.
Okay, now applied in Ecuador. Okay, in Ecuador, prolactinoma are one of the most important type of hypophyseal adenoma, by about 15 of these tumors. Now a video.
There are several serious conditions that must not be missed that cause breast discharge, including breast cancer and an intracranial mass leading to the production of milk. The first step in evaluating a patient with breast discharge is to decide whether there is an underlying breast condition present or if the patient actually has galactorrhea, defined as the production of milk. Breast conditions causing discharge include benign papilloma, but more worrisome is breast cancer. Red flags, which indicate an increased risk of a malignant breast tumor, include age over 40, and discharge that's unilateral, spontaneous, bloody, or serosanguinous. The breast should be checked to see if the discharge is uniductal and if there are any associated masses. The patient will need a full breast and local lymph node examination. You should order mammography and refer any patient with possible breast cancer to a breast center. Patients with galacturia typically present with milky, bilateral, and expressible discharge and usually have an elevated prolactin level. They often complain of oligo or amenorrhea, and for men, low libido and erectile dysfunction.
Now, in conclusion, is the prolactin is an important hormone for the body. A tumor that causes hyperprolactinemia is called a prolactinoma and can cause health problems such as vaginal dryness, erectile dysfunction, and gynecomastia. Now a video.
Erectile dysfunction. There are 5 causes to consider. 1. Physiologic. Are they pregnant now or recently, breastfeeding, or have they had chest wall trauma or disease? 2. Could they have an intracranial mass in the sella? Either a prolactinoma or a non-functional adenoma can cause galacturia by raising prolactin, the latter through stalk effect, i.e. blocking dopamine's inhibition of prolactin. High prolactin levels are measured in the blood. You must examine cranial nerves 2 to 6 and look for signs of pituitary hormonal deficiencies, amenorrhea, fatigue, weight loss, nausea, dizziness, constipation, cold intolerance. These patients will need a cellular MRI and referral to an endocrinologist. 3. Are they taking medications that raise prolactin levels like antipsychotic agents or gastrointestinal motility agents? 4. Do they have renal and liver failure causing reduced clearance of prolactin? 5. Do they have primary hypothyroidism? The key message regarding any patient, male or female, presenting with breast discharge is to rule out the possibility of breast cancer and make sure that a pituitary adenoma or other cellular lesion is not the cause of the discharge.